So thumb arthritis usually presents, patients have a swelling at the base of their thumb. I don't know if I can show you sort of in that region there. Swelling in the base of the thumb, it can feel achy. It can give them trouble, especially in the mornings of stiffness. But most patients eventually start to complain of difficulty in doing tasks that involve the use of the thumb. Keys, jars, lifting heavy kettles or pans. So they complain of issues with cooking and peeling vegetables and cutting vegetables using the thumb. Those are the main things. Eventually, apart from pain, they can develop a deformity of the thumb where the prominence hair over the bump becomes more pronounced. And you can sometimes get a situation where the span becomes decreased. And so you get a situation where the thumb has this deformity like that. I've got a problem with this thumb, but not much in the others. So you can see the difference between the two. But it can become quite marked such that they can't open the thumb away from the palm. Pain is the main issue and task that involve the use of the thumb, and especially opening tight jars, etc. So thumb arthritis is usually presents in the patient who becomes over 45 years. It seems to predominantly impact women more than men. If you've had previous trauma to your thumb, an injury to your thumb, it predisposes you to arthritis. Or if you've had it in hyperflexibility, in other words, what people might call double jointedness where they're quite flexible or hyperlax, that seems to predispose to thumb arthritis. So those are the main ones. If you're older than 45, if you are a woman, if you've had a previous injury to the thumb before, whether it be a fracture or a ligamentous injury, or you've had excessive amounts of work needing to work with your hands, those are the main ones that seem to predispose to developing thumb arthritis. So thumb arthritis can reduce the grip strength or the impression of grip strength significantly. The thumb is about 60% of hand function. And so if you've ever injured your thumb, you'd notice how much it affects your grip. All your activities of daily living seem to depend on your thumb. So keys, jars, picking things off a table, small objects, anything that requires a pinch grip, a tripod grip, writing with a pen also affects. That's a significant problem. And the grip strength is usually a power grip. That's what we're looking at. And so if people have to use their thumb, they end up with what we call a hook grip. So they're depending only on these fingers, because as soon as they apply their thumb, they're increasing the forces, sometimes up to 4 times at the base of the thumb. And so that is extremely painful for patients. And so they find that, oh, I can't use my hand. I said, what do you mean your hand? And they go, well, my thumb is so painful. I said, okay, so you can use your hand, you just don't want to because it's painful. So yes, but my grip isn't there. So opening doors as well can be affected. So treatment options really depend on the degree of arthritis and how significant the arthritis is, as well as the patient expectation and what their patient demands are. So if we start from early arthritis, the pain, the swelling, the discomfort with some tasks, but not all, and it's a period of time that is short in the development of arthritis, non-steroidal anti-inflammatories or simple painkillers may be helpful. There's some discussion about whether or not splints can actually be helpful. There are a number of studies that have been done over the past few years that seek to show the value of splints. Some believe that they are helpful. Others believe that they aren't really helpful after about 12 months. But a lot of my patients find actually they are helpful. The problem with splints is that they restrict the use of the thumb. So then patients have to take them off to do what they need to do. I've had a patient who tells me that the best treatment for her thumb arthritis is the fact that her husband is around. So she just hands him the things to open. So I said, well, I can't duplicate that for everyone, can I? But the point is, avoidance of certain activities that promote the pain is probably one of the other objectives, one of the other objectives of treating the arthritis. So avoiding the activities, painkillers, splints we touched on. Then steroid injections, guided steroid injections may be of benefit, and they are helpful in the short term, especially in early arthritis and relieving some of the pain. They may not be definitive. In other words, they may not last forever. Some patients get good results up to 3 to 12 months down the line from a steroid injection, depending on the degree of arthritis. But the arthritis may come back. Then we move on to surgical treatments. And surgical treatments are still evolving, I guess would be the way to put it. A lot of that depends on what the demands are for the patient. So surgical treatments involve keyhole surgery on the thumb. That's not widely practiced. Some have suggested that it is only for really early arthritis that's helpful. Then there is the fusions, in other words, making two bones, the long bone at the base of the thumb and the short bone beneath that, making those two bones, taking a joint out and fusing it into one bone. That does decrease some mobility, but it is really helpful, especially in a younger male patient who might be a manual worker or anyone who has to work a lot with their hands. That is a good option in providing the strength required in the long term, as well as taking the pain away. But it does have a long recovery period. Then there is the procedure of trapeziectomy. So that means removing the small bone at the base of the thumb, which prevents the rubbing of the two bones together, and then leaving a space with a false joint. That can sound a bit involved or destructive, but it's quite a simple procedure. You remove the bone and you leave the space and you hold the thumb in position, probably with a plaster for some period of time. Some people may put a wire in just to hold the position and that can prevent the rubbing of the bones together, provide the space, does get rid of the pain. Sometimes it takes a bit longer in terms of 6 to 12 weeks to get good mobility back. And and patients are happy with that, especially if they don't have very high demands. Some patients do complain that it doesn't quite give them the grip strength back that they hoped to have, but oftentimes patients are so painful they didn't have much grip strength before anyway. So once you take the pain away, some of the grip strength returns, and they're actually happy that they've had the procedure done, because they're better now in terms of grip strength than they were previously. Newer procedures are out there now, and that includes base of thumb replacement. And base of thumb replacement, although it hasn't been around as long as the time and tested trapeziectomy, it provides the fastest recovery we've seen so far. but patients may need another operation many years down the line. What this does is it provides the dexterity. So you go in, you put like a mini joint replacement, something looking sometimes like a mini hip replacement in the base of the thumb. And that keeps the length of the thumb, provides the dexterity, takes the pain away, and patients are mobilizing within a few weeks without even the need for a brace. Oftentimes we recommend they still have a brace, but I have sometimes to ask my patients just to slow down a bit because they are loving the thumb-based replacement. They want to get back to doing everything. I have patients who are tea ladies who are serving trays. I have patients who depend on the base of thumb to lift heavy notes in a clinic or an organization. They're thinking it's the best thing that they've ever done. They should have done it times before. But I caution them, this may not be the last operation. Many years on the line, they may need another operation. When I go to some of my patients and they ask me, okay, well, what's the difference between a trapeziectomy and a replacement? And I tell them, well, a trapeziectomy, your recovery is a little bit longer. Taking a bone out the recovery is a bit longer, but a replacement, your recovery is much faster, but you may need another operation down the line. And they say, well, what's the other operation down the line? And I go, well, it'll be a trapeziectomy. And they go, so why not give me the replacement now and do the trapeziectomy down the line? And I go, okay, fair point. So that makes sense as well. But sometimes down the line you may have to do another replacement because it doesn't last forever, and they are happy with that. The majority of my patients don't want the trapeziectomy first; they'd rather have the revision down the line and possibly the trapeziectomy. And then there's another procedure that seems to be often done, which is what they call a denervation, where you open the joint, all the nerves that provide the nerve pain, you just release those and you close the joint up. Patients, I have colleagues who do that, who are very good at doing that. It takes them a very little amount of time, but patients who come to me are suggesting that they want something definitive done, something to the bone to keep the thumb base, and so they don't fully understand why we're going to do one procedure or the other. With that, they want a definitive procedure, which is fine. So the options, just to go over, the options are painkillers, activity modification, in other words, avoid the activities that cause pain, splints that may be provided to help. The jury is out on whether or not it is particularly helpful. It really depends on the individual. Injections first, then surgical options, which could be a fusion, a trapeziectomy, a replacement, or denervation. And they have slightly different risk profiles, and I would recommend a particular procedure based on the degree of arthritis, the amount of symptoms, and the amount of demand that the patient needs for their day-to-day life on their thumb. Again, the jury's out on that. So activities that can manage thumb arthritis. Well, it's about learning to do the activity in a less thumb-dependent way. There aren't many activities that you can, many therapies that you can use to increase your thumb mobility to reduce the problems with thumb arthritis. I've got patients who write with just these two fingers, leaving the thumb out, just making sure the rest of the grip strength is good. But patients who have base thumb arthritis, there aren't many therapies that can help. Unless it's extremely early, then you can get something to settle the pain down, and you can then go back to using the thumb again, as you did before, but to a less demanding extent.